Yesterday, the World Health Organization declared the COVID-19 coronavirus as a worldwide health pandemic. We recognize institutions like the World Health Organization, the CDC, and the Utah Health Department as agencies commissioned to protect our health and the public welfare. Washington City emergency management teams have previously met to discuss the city's response to this outbreak. In light of this current declaration, however, the city will be instituting additional protective procedures to ensure our citizens' safety. Within the next few days, and with continued guidance from these health institutions, Washington City will be initiating some changes or restrictions on certain uses at the community center, public events, and/or upcoming celebrations. We will continue to refine our approach to ensure that we disrupt your life in the most minimal way possible, but to ensure the greatest safety. We will proceed with an overabundance of caution and would ask that you stay current to our social media sites, as well as signage that may be posted at the community center, city hall, or other public locations. We are grateful for your responsiveness, your cooperation, and patience. We are grateful for each other in this community and the way we have always cared for one another. Thank you very much. I'll turn time over to our city manager, Roger Carter.
Thank you, Mayor. As the Mayor mentioned, we're hoping to make our response to this flexible and nimble. I will talk specifically about a couple of things that the Mayor alluded to. Yes, our management team, emergency management team, met a couple weeks ago, and the purpose of our meeting was to discuss 4 issues. One, to become better educated with regards to the coronavirus, to talk about self-care and how we ourselves protect ourselves and our and others, the critical infrastructure and how we maintain the critical infrastructure, and our public spaces. I would like to speak specifically to our critical infrastructure and our public space, and then I'll turn some time over to Chief Matt Evans, our fire chief and emergency manager, to talk about self-care. As it relates to critical infrastructure, I know there's been some question about water and other city services. We can assure you that the critical infrastructure that the city has always provided, everything from water to sewage to safe streets to emergency service responses, will continue to be maintained. We train often with our employees to deal with disasters on every level, and so they're well knowledge in this area, and so there should be no concern with respect from our citizens with regards to whether they'll be able to get clean and safe water or whether emergency services would be able to respond in the event of an emergency. So we would like to assure you with regards to that. The second thing I would like to talk about is our public space. We do provide a lot of public space, and we provide a lot of activities as a city, and so let's take just a minute and briefly talk about that. Today at noon, Governor Herbert had a press conference that provided some direction to us as a municipality from our state leaders. One of the things that is recommended by the state is that we avoid gatherings and creating gatherings of 100 people or more, and these would be healthy people. There is a recommendation for people who might be elderly or have underlying health conditions that gatherings of any more than 25 should not be held. Now again, Washington City usually holds a number of events. The good news is that we're at the time of year in which most of our big activities, our sports events and other activities, are not happening indoors. We're in the soccer season, the baseball season. At this point, we do not see any reason to curtail those activities, as one, they are in an out-of-door environment, and in many cases wouldn't involve the recommended capacity of those. So we will continue to allow those to continue forward. We do offer at the community center a preschool and a daycare program. We have been and will continue to be in communication with the Washington County School District, who are our local experts as it relates to education and our children, and we will follow their lead with respect to the continuation of any of our preschool and daycare courses. If they choose to suspend, we would probably follow suit with that, and we'll continue to work with our partners there. We have a number of classes, over 50 classes and programs we offer on an ongoing basis at the Washington Community Center. And again, we've looked at those carefully. We recognize that sometimes those are done in small rooms with large amounts of people, and those criteria create part of our problem. Distance and spacing is important, and so at this point we'll be reducing those program sizes to no more than 20 participants. For those who want to continue, we'll try to add and supplement as many of those courses and programs as we can to accommodate all who want to participate. However, we would also probably recommend for those, again, who are elderly or have underlying health concerns, we would probably recommend that they at the moment not participate in these organized classes. If they have any questions about their enrollment or other things, they can feel free to contact the Washington City Community Center, and they can help them through that. At this moment, and with spring break coming, we anticipate we will keep the pool open. However, we would ask that those who might consider participating in the pool and bringing their family to the pool, that they follow all proper sanitary and hygiene that we would normally do anyway, and that is effective hand washing, showering before and after that they swim, and any other normal practices, safety practices that we would have for those participating in such event. In about 5 to 6 weeks we have planned our annual Cotton Days Festival. We at the moment have not made any plans to change that. However, we are monitoring the situation and would inform you that if there are any additional directions which would make us feel that those activities should be curtailed, we will certainly make that decision early enough and share those with you. As I mentioned, we believe that the best information we're getting is from those institutions that are tasked to take care of our health, and so we want to make sure that we are reflecting the most relevant and current information that we get. So we would encourage you to watch our social media sites, to pay attention to signage in our public buildings so that we can adjust and either create more restrictions on some things or hopefully to relax some restrictions as we get direction from those institutions. Again, along with the mayor, I want to thank you for your patience and for your understanding and for the great community that you are, and for the way we've helped each other through all of the challenges that we've faced throughout this community. I'll now turn the time over to Chief Evans.
Thanks. Well, we hope to share some information that isn't new to you, that is all things that you've heard of in the past, and for the most part, things that you're already practicing. Again, we're taking all this information from our county, our state health departments, the CDC. These are all recommendations that we know that help to reduce the spread, not just of this virus, but of most of the things out there. So they really come down to general and just basic hygiene practices, and of course the simplest one starts with hand washing. We talk about hand washing, and we say we should wash our hands, but what does that really entail? The recommendation is soap and water, and then we're actively washing for at least 20 seconds, somewhere between 20 and 30 seconds. They say you can find a hymn or a song and figure out that 20-30 seconds. An example might be singing Mary Had a Little Lamb a couple of times in your head so that you know how long you've been washing your hands for, to ensure that you're doing it long enough to truly get rid of the germs that are on your skin. If you don't have water and soap available, the second best thing is a hand sanitizer. What the recommendation there is that it needs to be an alcohol based, and that we ensure that it's at least 60% alcohol to ensure that it'll actually work to do anything to help in getting rid of the bad stuff that's on your skin. The next two might take a couple of change in habits. They say that as just a general habit, we touch our face hundreds of times over the course of every day. And of course, that is part of that facilitates the spread of most things that are out there that are contagious, especially person-to-person contact. And so if we can be more aware of when we do that and try to decrease and not do that at all, we would then be able to better take care of ourselves and hopefully stay healthier. The other piece would be if we, or really when we cough or sneeze, that we do so in a tissue so that we can then get rid of the tissue, as opposed to coughing and sneezing in our hand or even in my elbow on my shirt, and then I'm going to carry that around and have the possibility to further spread. That next piece is when we don't feel good, and that inevitably is going to happen. There's plenty of other things spreading around besides the coronavirus, but when we don't feel good, is to stay home and ensure that we're not spreading whatever it is that we have, and keeping that to ourselves, giving our body a chance to get over it, and then be in contact with our healthcare provider. Of course, the newest recommendation is that we don't just go to the healthcare provider, that we contact them through one of the telemedicine options by phone or by the internet to get some guidance at what the next best step for us would be. Again, all this information is really nothing new. It's all stuff that has been out there for a long time, long before this virus came around. But it's just a reminder, and a reminder so that obviously if you don't take care of yourself, you can't take care of those people that are around you. And to echo what was said, thanks for the community that you are, and it is absolutely a pleasure to serve you. If you have any questions or anything that we can help with, don't hesitate to contact us. Thanks, man.